CBS News correspondent David Martin on Operation Warp Speed.
I was told to have available a vaccine for all of Americans.
For our story this week on 60 Minutes, we got exclusive access into Operation Warp Speed.
But what's going on in there is growing a virus?
Yeah, exactly.
The federal government's plan to manufacture and distribute 600 million doses of COVID-19 vaccine.
Break it down into small parts, start it, and then escalate rapidly. So my goal, tens of millions in December, hopefully, and we expand into hundreds of millions January, February, March.
Four-star General Gus Perna leads the operation,
Our overall objective.
and he told us one of the challenges he faces is that most of the vaccines require 2 separate shots.
The second dose has to be stored and executed with discipline. It is probably our most vulnerable piece in the distribution.
So in the meeting, you said the greatest vulnerability is that second dose. Why?
5 of the 6 vaccines require 2 doses. And so what we want to do is make sure that in our distribution plan and eventual administration of the vaccine to an individual, that we have the second dose available. We don't want you, David, showing up, getting your shot, being told to come back 21 days later, and the second shot is not there.
What do you think is the weakest link in the distribution chain?
And we have to ensure that everybody understands the allocations they're going to get, understand the cadence of which allocations are going to come at them. Then we need them to connect in Tiberias and tell us where they want us to put the vaccine.
Where you're allocating, and it color codes the map in counties and cities by how many doses that you've allocated.
Tiberias is a proprietary software program created for Operation Warp Speed.
You can turn on where your hospitals are, where your pharmacies, your nursing homes, and where all of your enrolled providers are inside.
It's supposed to link together different databases to allow Perna to track the vaccine every step of the way from manufacture to inoculation.
At the beginning of the pandemic, states were competing against each other for supplies, ventilators, masks. Are they going to have to compete against each other for the vaccine?
My view is the answer is no to that. The planning that we've done, the planning that we demonstrated to you just earlier this morning has the premise of fair and equitable distribution across the 64 jurisdictions of the United States. And then we need, in my opinion, the governors and their staffs who are responsible for their states to really understand and then make final decisions for distribution of the vaccine.
Well, how do you decide how much goes to each state?
Well, I've proposed several recommendations. The decision will be up above us. It'll be a board that convenes with several scientists. Dr. Fauci is a part of that. Dr. Birx is a part of that. Dr. Redfield from the CDC is a part of that.
Can you guarantee that Democratic states will be treated the same as Republican states?
As far as I am concerned, right, me personally, responsible for the mission of distributing the vaccine, it will be fair and equitable across the United States of America.
Perna estimates Operation Warp Speed has cost the American taxpayer roughly $12 billion so far, but expects that number will grow to as much as $26 billion.
Are people who get the shot going to have to pay for it?
No, we've been told that we are buying the vaccine, right? So we've already purchased the vaccine if we're going to distribute it. And people who are insured, insurance companies will pay for the administration costs. People who are uninsured, the Secretary of Health and Human Services is working with CMS, and they've established a policy that uninsured people will have the vaccine available to them. The goal, of course, is that all people have access to the vaccine, no matter where they are in America or what their status is financially.
So you're not going to be out of pocket any money getting a shot, but since these are taxpayer dollars, you've already paid for the vaccine.
Absolutely.
You've seen the polls that show an increasing number of Americans are expressing doubt about taking
Sure.
the vaccine.
Sure.
That's got to concern you.
It does, right? Because I believe with my name, thinking about my mother and her husband, elderly, thinking about my 3 granddaughters. That's what I'm visualizing, right? And shame on us if we produce this vaccine and we distribute it to the American people and we lose their confidence and they don't take it. Shame on us.
You can manufacture vaccine, but how do you manufacture trust?
It's a leadership thing, right? I will be standing in the line, right, when the vaccine comes out.
You going to get one of the first shots?
I will. I'll stand up and get it, and I'll be proud of it.